Cancer doesn't choose, so don't blame yourself for having cancer. It is an extremely difficult journey, both mentally and physically, and I think you shouldn't fight this battle by yourself. Hi, I'm Eldon Lee. I'm 31 years old, married to my lovely wife, and we have a 1-year-old son. In April 2021, I was initially diagnosed with stage 3A non-small cell lung cancer. Recently, however, it has advanced to a stage 4 lung cancer. It started as a normal cough. I speak a lot during my work, and I noticed that whenever I spoke, it would trigger a cough. So I went to the clinic to get a checkup about 3 to 4 times. Each time, the doctor would increase the strength of my normal cough medicine or dosage. When that didn't work, the doctor encouraged me to go for an x-ray. A few days after the x-ray, the doctor called me urgently and told me that there was a shadow on my left lung. I thought that it might be TB at first, as the symptoms were quite similar. I went to get a biopsy done at Sengkang General Hospital, and that's when I found out that it was lung cancer.
Eldon was diagnosed with stage 3 lung cancer, and the intention for treatment for patients with stage 3 lung cancer is curative. Therefore, what we try to do is to give patients who are fit and healthy the highest levels of doses that are possible with the intent of completely eradicating the cancer. Lung cancer, as it arises in the lungs, may firstly present with no symptoms whatsoever. Cancers that grow large enough probably start causing symptoms such as cough, breathlessness, drop in stamina, and it is entirely possible that cancers that grow in a slightly more strategic manner, for example, in the center of the chest, may present with symptoms such as bleeding and blood in phlegm when coughing.
The hardest part about the diagnosis was the waiting period. There were a few tests to go through, CT scans, PET scans, and sometimes a week of waiting for the results. That's when my mind would run through all the what ifs. What if it's bad news? What if it's good news? I started thinking about my wife and son and what were the worst case scenarios. Sometimes you don't know when to start thinking about it. I stopped going to the gym and playing basketball because I was too worried that my lungs wouldn't be able to handle the stress. Although my appetite didn't really change at first, I made sure to switch my diet to include healthier ingredients. It was only during the later cycles that I would start feeling some nausea. At that point, I had to adjust my diet to include more porridges and soups and not such strong smelling foods. I think when someone first starts seeing symptoms, they tend to look for solutions online or through friends and family for advice. But each person's body is different, and while friends and family are coming from a good place, you should always speak to your doctors and medical care team. When I found out that my cancer has advanced to stage 4, it felt like I was hit by a truck. My mind went blank.
Unfortunately, for some stage 3 cancers, we know that up to 80 to 90% of patients may actually relapse after initial curative intent treatment. This is quite challenging to deal with, but nevertheless, I think it also means that patients are fully aware that this is unfortunately something that is a reality.
I went home to tell my wife, and it was heartbreaking. But what we got out of that painful day was that we were able to share our pain. I think that's the most important part to me. That's why, since the start of my journey, I decided to share my story on social media. I was surprised and overwhelmed to see the amount of support from family and friends. There was support from friends in other countries like New Zealand and Cambodia. A pastor from Australia even reached out to tell me that someone had shared my story with him. I noticed that a lot of people were telling me that I was courageous and brave for sharing it on social media. I thought, how is this bravery? I'm simply sharing my story. Then it occurred to me that maybe some people choose to not tell the story. But why? It is an extremely difficult journey, both mentally and physically, and you should not have to feel alone through it all. So it is important to have a strong support system, whether it's at home, with your family, or even a community. Pain, when shared, can help to lessen the burden on your shoulders. Through all the worry and anxiety, there was a sense of clarity. Yes, the news was hard, but it didn't feel like a death sentence to me. I can accept it and continue to think about what I can do next and plan for the next stage of my life. So to keep positive, I make plans. It keeps my mind focused on moving forward and not to dwell on the cancer, as dwelling on it won't make the cancer go away. I finally had a closure.